Listen to me carefully, because what I'm about to tell you will challenge everything you were taught about your body, your pleasure, and your right to feel alive at any age. After 3 decades in clinical practice, I've learned that the most dangerous lie we tell mature women isn't about wrinkles or gray hair. It's about desire. It's the insidious belief that sexual vitality has an expiration date, that pleasure becomes inappropriate after a certain birthday, that touching yourself with intention and curiosity is somehow unseemly when you've lived more than 6 decades on this planet. Stay with me until the end, because I'm going to dismantle that myth with clinical precision and give you permission, no, better yet, a medical prescription, to reclaim what was always yours. Before we go any further, I need you to do something for me. Subscribe to this channel right now, and down in the comments tell me, have you ever been told you're too old to want? Write it, share it, because your voice matters and I need to know you're listening. Now let's talk about what nobody wants to discuss at family dinners or church gatherings or even in most doctors' offices. Female sexuality after 60, self-pleasure, masturbation. I'm using the clinical term because that's what it is. A legitimate health practice with measurable benefits for your nervous system, your cardiovascular health, your sleep quality, and your emotional resilience. Yet somehow we live in a culture that celebrates Viagra commercials during prime time, but recoils at the thought of a woman my age or yours exploring her own body with the same curiosity she might bring to a new recipe or a yoga class. The science is unequivocal, and I don't say this lightly. Regular sexual activity, including masturbation, increases blood flow to pelvic tissues, maintains vaginal elasticity, supports hormonal balance even after menopause, reduces cortisol levels, releases endorphins and oxytocin, improves sleep architecture, and contributes to overall psychological well-being. These aren't trivial benefits. They're the difference between a body that feels alive and a body that feels like it's waiting for permission to shut down completely. I've sat across from hundreds of women in my office who whisper their questions as if confessing sins. Is it normal that I still want? Yes. Should I feel guilty? Absolutely not. What if my partner isn't interested anymore? Or what if I don't have a partner? Then you become your own loving companion. But Dr. Montes, isn't that lonely? And this is where I lean forward and say what I'm about to say to you now. Solitary pleasure isn't loneliness. It's self-sufficiency. It's the radical act of saying my body deserves attention and care regardless of who's sharing my bed. Let me take you back to a conversation I had 2 years ago with a patient I'll call Margaret. 63 years old, recently widowed after 40 years of marriage, sitting in my office with her hands folded so tightly her knuckles were white. She'd come in complaining of insomnia, anxiety, a vague sense of restlessness she couldn't name. We talked about sleep hygiene, stress management, the grief process. Then, almost as an afterthought, she mentioned she hadn't felt that way in years, not during the last decade of her marriage when her husband was ill, and certainly not since his death. I thought it just went away, she said, like it was supposed to. I asked her a simple question. Do you miss it? The tears came immediately. Not sad tears, furious ones, because yes, she missed it. She missed feeling wanted, feeling vital, feeling like her body was more than a vehicle for caregiving and medical appointments and managing everyone else's needs. We spent that session talking about anatomy, about the clitoris as an organ designed purely for pleasure, nothing else, just pleasure, and how that doesn't become obsolete at any age. I gave her educational resources, normalized her feelings, and suggested she might experiment with self-touch as a form of self-care, no different from moisturizing her skin or taking her vitamins. 6 weeks later, she came back transformed. Not because she'd found a new partner or started some radical treatment, but because she'd reconnected with a part of herself she thought was dead. Her sleep improved. Her anxiety decreased. She smiled more. And she said something I'll never forget. I feel like I took back something that was stolen from me, not by my husband, not by anyone specific, just by this idea that I was finished. You're not finished. Your nervous system hasn't received that memo. Your capacity for pleasure isn't governed by your birth certificate. It's governed by blood flow, nerve endings, neurochemistry, and most importantly, your willingness to claim it. Now, let's address the elephant in the room: technique. Because if we're going to have this conversation, we might as well have it properly. The way you approached masturbation at 20 or 30 or 40 may not serve you at 65, and that's not a problem. It's an opportunity. Your body has changed. Your tissue sensitivity has changed. Your hormonal landscape has changed. Your relationship to time and urgency has changed. This requires adaptation, not abandonment. After menopause, estrogen levels drop significantly, which affects vaginal lubrication, tissue thickness, and elasticity. This is physiology, not failure. It means you'll likely need more time for arousal, more intentional stimulation, and yes, probably a good quality lubricant. Water-based or silicone-based, fragrance-free, pH-balanced. This isn't optional. It's essential. Friction without lubrication causes microtears in delicate tissue, which leads to discomfort, which leads to avoidance, which leads to atrophy. It's a cascade we can prevent with a $15 bottle from any pharmacy. Start slowly, and I mean genuinely slowly, not the rushed, goal-oriented approach so many of us learned when we were younger and worried about being caught or running out of time. You have time now. Use it. Begin with touch that has nothing to do with genital contact: your arms, your neck, your breasts, your thighs. Reawaken your entire sensory system, not just one specific zone. Your skin is your largest organ, and it's covered with nerve endings that respond to gentle pressure, warmth, texture. When you do focus on genital touch, approach your clitoris with curiosity rather than efficiency. The clitoris, by the way, isn't just that small external nub, it's an iceberg. The visible portion is maybe a fifth of the total structure. The rest extends internally, with roots that reach several inches into your pelvis. Those internal structures respond to pressure, to vibration, to rhythmic stimulation. Experiment with indirect touch around the clitoral hood rather than directly on the glands, which can be overwhelmingly sensitive, especially if you're not fully aroused yet. Arousal takes time. Statistically, women require an average of 20 to 40 minutes of stimulation to reach peak arousal, and that time frame often increases with age. Not because something's wrong, but because your neurological response has matured. You're not chasing a sprint anymore. You're savoring a long walk through interesting terrain. Notice what you feel. Notice where tension builds. Notice the quality of the sensations. This is mindfulness in its most embodied form. If manual stimulation becomes tiring, and it might, arthritis and joint pain are real, consider vibrators designed for mature users, rechargeable, ergonomically shaped, with multiple intensity settings. There's no shame in using tools. You wouldn't refuse glasses if your vision blurred. Why refuse assistive devices for pleasure? The Dame Air, the Womanizer, the Satisfier, these aren't just clever marketing names, they're actually engineered around clitoral anatomy, using air pulse technology that stimulates without requiring direct friction. For many women dealing with tissue thinning or sensitivity, this indirect stimulation is revelatory. But here's what I want you to understand beyond technique. This practice isn't just about reaching orgasm. In fact, making orgasm the sole goal often undermines the entire experience. What you're cultivating is a relationship with sensation, with presence, with your own capacity to feel and respond and be fully alive in your body. Some sessions will end in climax, some won't. Both are valuable. Both are forms of self-care. The neurochemistry here matters. When you engage in pleasurable touch, your brain releases dopamine, the neurotransmitter associated with reward and motivation. It releases oxytocin, the bonding hormone that creates feelings of contentment and reduces anxiety. It releases endorphins, your body's natural pain relievers. After orgasm, there's a surge of prolactin, which promotes relaxation and sleep. This is medicine, prescribed by your own body, administered through your own hands with zero copay. Have you ever wondered why you sleep better after sexual activity? It's not mysterious. It's the parasympathetic nervous system finally getting permission to dominate. We spend so much of our lives in sympathetic activation, in fight or flight, in stress response. Sexual arousal and release is one of the most reliable ways to activate the rest and digest system, to signal to your body that you're safe, that there's no threat, that relaxation is permitted. I want to pause here and address something that comes up frequently in my practice: the guilt. The internalized messages that touching yourself is selfish, shameful, or somehow less legitimate than partnered sex. Let me be clinically clear. Masturbation is not second-rate sexuality. It's primary self-care. It's how you learn what feels good, how you maintain sexual response capacity, how you claim agency over your own pleasure without needing anyone's approval or participation. Think about how we learned shame around this. Many of us grew up in eras and cultures where female sexuality was barely acknowledged, let alone celebrated, where our bodies were for childbearing and male pleasure, full stop, where touching yourself was considered dirty or dangerous or a sign of desperation. Those messages were designed to control us, to keep us dependent on external validation for our worth and our pleasure. Unlearning them isn't easy, but it's necessary. One of my patients, I'll call her Rosa, came to see me at 68 with complaints of chronic tension, difficulty relaxing, persistent low-level anxiety that medication wasn't fully addressing. She was a retired teacher, widowed, living alone, with adult children in other states. When I asked about self-care practices, she listed all the usual things: reading, gardening, volunteering. When I gently asked about sexual health, she looked horrified. At my age, with no husband? Absolutely not. We talked about it over several visits. I explained the physiological benefits, the neurochemical effects, the difference between sexuality as performance for someone else and sexuality as self-nourishment. I gave her reading material. I normalized it. Slowly, her resistance softened. Not because I convinced her she was wrong, but because I gave her a medical framework that made sense. This isn't about morality. It's about physiology. A year later, she told me she'd started what she called her evening ritual: bath, body oil, quiet music, and yes, self-touch. I still feel a little embarrassed admitting it, she said. But Dr. Montes, I sleep through the night now. I don't wake up with that tight feeling in my chest. I feel, I don't know, softer somehow. More at home in my body. That's what we're after. Not performance, not validation, not living up to some imaginary standard. Just feeling at home. Let's talk about another obstacle. Physical changes that make traditional approaches difficult. Maybe you've had a hysterectomy. Maybe you have pelvic floor dysfunction. Maybe you have diabetes, which affects nerve sensitivity. Maybe you're on medications that impact arousal, SSRIs, blood pressure medications, antihistamines, all can dampen sexual response. None of these conditions make pleasure impossible, they just require adaptation. If you have reduced sensation, increased stimulation intensity or duration, if you have pain with penetration, focus exclusively on external stimulation. Remember, the vast majority of women don't orgasm from penetration alone anyway. If you have mobility limitations, use pillows to support your body, try positions that don't strain your joints, or explore hands-free devices. If you have vulvar pain conditions like vulvodynia, work with a pelvic floor physical therapist to identify what's safe and comfortable. There are always options, and if you're on medications that affect arousal, talk to your doctor about alternatives or timing adjustments. Some SSRIs have lower sexual side effects than others. Some blood pressure medications are less problematic. You don't have to just accept diminished sexuality as the price of managing other health conditions. That's a false choice. I want to circle back to something crucial: the mental component. Arousal doesn't happen just in your genitals, it happens in your brain. The most important sexual organ you have is between your ears, not between your legs. What you think about, what you allow yourself to imagine, what you give yourself permission to desire, all of this matters enormously. Many women tell me they've lost the ability to fantasize, that their minds have become too practical, too focused on to-do lists and responsibilities. I understand, but fantasy is a muscle. It atrophies with disuse and strengthens with practice. You don't need elaborate scenarios or pornographic imagery. You need whatever creates a sense of anticipation, warmth, curiosity in your body. Maybe it's a memory from decades ago. Maybe it's an imagined scenario with a celebrity crush. Maybe it's pure sensation without any narrative at all, just focusing on how touch feels, amplifying it in your imagination. Your brain is wildly neuroplastic, even in your 60s and 70s and beyond. You can create new neural pathways around pleasure and arousal. The key is repetition and attention. Where you place your attention, neural connections strengthen. If you consistently redirect attention to pleasurable sensation, your brain learns to prioritize and amplify those signals. This is why mindfulness during self-pleasure is so powerful. You're not just physically stimulating nerve endings, you're training your brain to recognize, interpret, and value those sensations. Over time, arousal becomes easier to access, pleasure becomes more vivid, orgasm becomes more reliably achievable, not because your body has fundamentally changed, but because your nervous system has been re-educated. Now some of you are thinking, but Dr. Montes, I've tried. It doesn't work. I can't feel anything anymore. I hear you, and I want to offer a different perspective. When someone tells me they feel nothing during attempted self-pleasure, I always ask, what does nothing feel like? Because truly, nothing, complete absence of sensation, is extremely rare barring significant nerve damage. More often, what women describe as nothing is actually not enough, or not what I expected, or not like it used to be. Recalibrating expectations is part of this process. You may not experience the same intensity you did at 30. Your orgasms may be subtler, more diffuse, less obviously peaking. That doesn't mean they're inferior, they're different. Some women describe postmenopausal orgasms as deeper, more full body, less genitally focused. Others find they can have multiple smaller orgasms rather than one intense climax. None of this is wrong or less than. It's evolution. Give yourself at least 10 to 12 sessions before deciding whether something works. Your first few attempts will likely feel awkward, unfamiliar, maybe frustrating. That's normal. You're developing a new skill set, relearning your body, overcoming decades of conditioning that told you this wasn't for you. Be patient with yourself. Be curious rather than judgmental. Notice what happens without demanding specific outcomes. And please, create the right environment. This isn't something to squeeze in during commercial breaks or while half listening for the phone. Set aside actual time, 30 minutes, an hour, when you won't be interrupted. Lock the door. Turn off your phone. Create warmth and comfort. Soft lighting, comfortable temperature, maybe music that relaxes you. Treat this as sacred time for yourself, because it is. I also want to address something many women don't realize. Pelvic floor health is intimately connected to sexual sensation and function. Your pelvic floor muscles support your bladder, uterus, and rectum, but they also contract rhythmically during orgasm. When these muscles are weak or overly tight, sexual response suffers. Kegel exercises aren't just about preventing incontinence, they're about maintaining sexual function. But here's what most people get wrong about Kegels. It's not just about squeezing. You also need to learn to release fully. Many women, especially those who've carried chronic stress or tension, have hypertonic pelvic floors, muscles that are chronically clenched. Adding more squeezing makes things worse. You need to practice the complete cycle. Contract, hold, release fully, rest, and you need to breathe throughout. Holding your breath creates tension everywhere, including your pelvic floor. If you're unsure whether you're doing pelvic floor exercises correctly, see a pelvic floor physical therapist. Yes, this specialty exists, and yes, it's worth it. These therapists can assess your muscle function, identify imbalances, and teach you proper technique. They can also address pain issues, scar tissue from childbirth or surgery, and coordination problems that affect both continence and sexual function. This isn't frivolous healthcare, it's essential to quality of life. Let me share another patient story. Linda came to me at 71, referred by her gynecologist for what they'd been calling treatment-resistant vaginal atrophy. She'd tried topical estrogen, lubricants, dilators, nothing helped. She had pain with any kind of penetration and had given up on sexual activity entirely. When I examined her history, I found she'd had 3 vaginal deliveries, one with significant tearing, plus a hysterectomy 20 years prior. She'd never worked with a pelvic floor PT. We got her set up with a specialist. Turns out she had extensive internal scar tissue creating adhesions, plus severe pelvic floor muscle dysfunction. Some muscles were too weak, others were locked in spasm. After 6 months of skilled physical therapy, including manual tissue work, therapeutic exercises, and biofeedback training, her pain decreased by about 70%. She was able to resume penetrative activity with her partner and reported that even non-penetrative touch felt more pleasurable because she wasn't bracing against anticipated pain. Pain creates fear. Fear creates tension. Tension creates more pain. It's a vicious cycle, but it's also breakable. If you have persistent pain with any kind of sexual activity, don't just accept it, investigate it. There are usually treatable causes: muscle dysfunction, tissue changes, nerve sensitivity, scar tissue, skin conditions. Suffering in silence helps no one. I want to shift gears slightly and talk about something that affects sexuality profoundly but isn't often discussed: body image in later life. We live in a culture obsessed with youth, where aging bodies are considered defective rather than normal. Skin loses elasticity, breasts change shape, vulvas look different after menopause, the labia may become thinner, less pigmented, sometimes less symmetrical. Pubic hair grays or thins, bellies may be softer, scars tell stories of surgeries and childbirth. These changes are not failures, they're evidence of a life lived. But if you hate what you see in the mirror, if touching your own body fills you with disgust or shame, then self-pleasure becomes nearly impossible. You can't be present to sensation while you're criticizing your appearance. Healing body image issues is complex work that may require therapy, but I can offer a starting point: gratitude. Not toxic positivity or forced affirmations, but genuine appreciation for what your body has done and continues to do. Your legs carried you through life. Your hands created things. Your belly may be soft, but it housed children or digested thousands of meals that gave you energy. Your breasts fed babies or gave pleasure or were sensitive to your lover's touch. Try this practice. Before you engage in any self-pleasure, spend 5 minutes simply placing your hands on different parts of your body and saying thank you. Not because they look a certain way, but because they function, because they're part of you, because they deserve care. This isn't about believing you're beautiful by conventional standards. It's about developing appreciation and respect for your physical form, regardless of appearance. And here's a truth I've observed over decades of practice. When you engage with your body from a place of curiosity and care rather than judgment, when you focus on sensation rather than appearance, your experience of pleasure deepens dramatically. Because you're finally present. You're not dissociating or performing or monitoring yourself from outside. You're inhabiting your actual body, feeling what's actually happening. Speaking of presence, let's discuss why so many women have trouble staying focused during sexual activity. Your mind wanders to grocery lists, to what you said in that conversation yesterday, to whether you turned off the stove. This isn't moral weakness. It's how the human mind works, especially minds that have spent decades managing households and careers and relationships. You've trained yourself to multitask, to stay vigilant, to never fully let go. Retraining your attention is possible, but requires practice. Start with breath awareness, just 5 minutes of noticing your natural breathing pattern without changing it. When your mind wanders, and it will, gently return attention to breath. This is the foundation of mindfulness, and it translates directly to sexual experience. When your mind wanders during self-pleasure, you notice without judgment and return attention to physical sensation, over and over, patiently, compassionately. Eventually, staying present becomes easier. The gap between thought and sensation narrows. You find yourself more fully absorbed in what you're feeling. This state of flow, of complete presence, is where pleasure intensifies and orgasm becomes more accessible. You can't force flow, you can only create conditions that invite it. Quiet space, adequate time, gentle persistence, and most importantly, self-compassion when attention drifts. I want to address something uncomfortable now: shame spirals after masturbation. Some women feel fine during the experience, but immediately after, they're flooded with guilt, self-criticism, or a sense that they've done something wrong. This is conditioning. This is decades of messaging that your pleasure is illegitimate, selfish, or shameful. It's not based in reality or health, it's based in social control. When these feelings arise, name them. Say out loud, "This is internalized shame. It's not truth. What I just did was healthy self-care." Then practice self-compassion. Place a hand on your heart and say something kind to yourself, the way you'd comfort a friend. You deserve to feel good. Your body deserves care and attention. There's nothing wrong with you. This process of talking back to shame takes time. You're undoing programming that may have started in childhood. Be patient. The shame response will gradually weaken with repetition of the behavior plus compassionate self-talk. Eventually, the pleasure remains and the shame fades. But you have to persist through the discomfort, trusting that the psychological freedom on the other side is worth it. Let's talk about variety and exploration. One reason sexuality can become routine or boring is lack of novelty. Our brains respond powerfully to newness. It triggers dopamine release, enhances attention, makes experiences memorable. This doesn't mean you need to become wildly experimental or do things that feel uncomfortable. It means approaching familiar practices with slight variations. Change the time of day you engage in self-pleasure. Change the location, maybe a comfortable chair instead of your bed. Change the type of touch. Use a soft fabric or a feather instead of just your hands. Try temperature play with warm oil or cool gel. Listen to different music or erotic audio. Read erotica if that interests you. Explore visual imagery if you're comfortable with it. Use fantasy narratives that are completely outside your actual life experience. There's no requirement that fantasies be realistic or represent things you'd actually want to do. The point is to keep your nervous system slightly surprised, slightly curious, slightly uncertain about what's coming next. This prevents habituation, where your body and brain become so accustomed to a specific routine that arousal diminishes. Think of it like eating the same meal every single day. Eventually, even your favorite food becomes boring. Sensation needs variation to stay vivid. I also want to emphasize something about frequency. There's no right amount. Some women will want to engage in self-pleasure multiple times per week, others once a week or once a month. What matters is that the frequency feels good to you, meets your needs, and doesn't arise from obligation or pressure. This is about enhancing your life, not adding another should to your already too long list of shoulds. That said, consistency matters more than intensity when you're rebuilding sexual response capacity. If you've been disconnected from your sexuality for years, engaging once every few months probably won't create meaningful change, but 15 minutes twice a week will, over time, retrain your nervous system to recognize and prioritize pleasure signals. You're building a practice, not checking a box. Now, let's address a question I get frequently. What about partnered sex versus masturbation? Are they in competition? Should you prioritize one over the other? And what if you have a partner who's uncomfortable with your self-pleasure? First, these aren't competing activities. They're complementary. Masturbation teaches you about your body, your response patterns, what you like. That knowledge then translates to better communication with a partner. Many couples actually find their sex life improves when both partners have active self-pleasure practices because there's less pressure, more body awareness, better understanding of individual arousal patterns. If you have a partner who's threatened by your masturbation, that's information about their insecurity, not about your behavior. Your body belongs to you. Your pleasure belongs to you. You don't need anyone's permission to touch yourself. That said, relationships require communication. You might explain that this practice helps you sleep better, manage stress, stay connected to your body. You might reassure them that this doesn't mean you're unsatisfied with partnered sex. You might gently suggest that their discomfort is worth exploring, perhaps in therapy. But ultimately, if a partner demands you not engage in healthy self-care that harms no one, that's a red flag about control, not about love. Healthy relationships trust each other's autonomy over their own bodies. For those of you without partners, I want to say this clearly. You are not missing out on the real version of sexuality and settling for second best. Solo sexuality is complete and valid in itself. It's not practice for the main event. It is its own event. The sooner we collectively embrace this truth, the less we'll pathologize single women's sexuality or treat it as something sad or lacking. I see so many women in my practice who've internalized the message that their sexuality only counts if witnessed or validated by a partner. That pleasure alone in a quiet room somehow doesn't register as real. This is nonsense. Your orgasms aren't less legitimate because no one else was there. Your arousal isn't less real because you created it yourself. Your sexual self doesn't exist only in relation to another person. It exists in relation to you. Reclaiming this truth is profoundly liberating. It means you can have a full, satisfying sexual life regardless of relationship status. It means your worth and your capacity for joy aren't dependent on anyone else's participation. It means you can stop waiting for permission or validation or the right circumstances and simply give yourself what you need. Let me tell you about Elena, who came to see me at 64 after her divorce was finalized. 37 years of marriage ended because her husband had an affair with a much younger woman. Elena was devastated, not just by the betrayal, but by the message it seemed to send. That she was no longer desirable, that her sexuality had expired, that she'd failed to keep his interest. We worked on this for months. Slowly, she began to separate her worth from his choices. She began to see that his affair said nothing about her attractiveness and everything about his character. But the deeper work was helping her reconnect with sexuality as something that belonged to her, not something she performed for male validation. She started with basics, really looking at her vulva with a mirror, learning anatomy she'd never been taught, touching herself without any goal beyond curiosity. It was hard at first. She felt ridiculous, too old, too damaged. But she persisted, and gradually something shifted. She began to enjoy the sensations. She began to feel ownership over her body in a way she never had, even in her youth. 2 years later, she's in a new relationship, but she told me something beautiful. Even if this doesn't work out, I'll be okay, because I know now that I can give myself pleasure. I'm not dependent on someone else to feel alive in my body. That's the real freedom. That's what I want for you. Not just better technique or stronger orgasms, though those are nice, but the bone-deep knowledge that your sexual self belongs to you, functions for you, and needs no external validation to be valuable. Let's talk about some common obstacles and solutions in practical terms. Maybe you have arthritis in your hands and manual stimulation is painful. Consider using toys with ergonomic handles or hands-free devices that require no gripping. Maybe you have limited privacy because you live with family or in assisted living. Use a locked bathroom, a white noise machine, or fan to mask sound. And don't feel guilty about taking time for yourself behind closed doors. Maybe you were raised in a religion that condemned masturbation as sin. This is harder to navigate because it involves deeply held beliefs. But I'll offer this. Many religious traditions recognize the body as sacred, as a gift, as something to be stewarded with care. Self-pleasure that maintains health, reduces suffering, and honors your embodiment might be reframed as a form of stewardship rather than sin. But this is personal work you may need to do with a spiritual director or therapist who understands both sexuality and religious tradition. Maybe you simply don't know where to start because you never learned. That's okay. Start with exploration that isn't goal-oriented. Spend time touching your entire body, noticing what feels good, pressure, warmth, texture. When you're ready, use lubrication and explore external genital touch, focusing on the clitoral area but not exclusively. Notice where sensation builds. Notice your breath. Notice tension and relaxation in your body. Don't judge any of it, just gather information. Maybe you're dealing with trauma history that makes any kind of sexual touch triggering. This requires careful, often professional support. Trauma-informed therapy, possibly somatic therapy, can help you develop resources for feeling safe in your body again. Self-pleasure can be part of healing, but it needs to be approached slowly with lots of control and the ability to stop anytime you need to. This isn't something to rush or force. For those managing chronic pain conditions, sexuality can feel impossible. But pleasure and pain aren't mutually exclusive. They're processed in overlapping but distinct neural pathways. During sexual arousal, pain perception actually decreases due to the release of endorphins and activation of descending pain modulation pathways. This doesn't cure chronic pain, but it can create windows of relief. Timing sexual activity for when pain is at baseline, using comfortable positions, and focusing on pleasure rather than performance can make this accessible even with significant pain conditions. I want to circle back to the broader question, why does this matter? Why am I, as a physician, advocating so strongly for postmenopausal sexuality and specifically for masturbation? Because denying women access to their own pleasure is a form of violence. It may be subtle, culturally sanctioned violence, but it's violence nonetheless. It says your body exists for utility, for reproduction, for caregiving, for labor, but not for joy. It says that once you've fulfilled those utilities, you should quietly accept diminishment. I reject this entirely. Your pleasure matters because you matter. Your body deserves care and positive sensation because you're alive and sentient, not because you've earned it through productivity or attractiveness or youth. The ability to feel pleasure is a fundamental aspect of being human, and deliberately disconnecting from that ability because of age or social messaging is a tragic loss. Moreover, sexuality is deeply connected to overall vitality. Women who remain sexually active, whether partnered or solo, report better quality of life, less depression, better cognitive function, and even longer life expectancy in some studies. The causality is complex, but sexual activity is both a marker and a contributor to overall health. When you abandon sexuality, you're often abandoning a broader sense of aliveness. This doesn't mean you must be sexual to be healthy or that asexual people are doing anything wrong. For individuals whose orientation is genuinely asexual, who experience no sexual attraction or desire, that's completely valid. But for women who do experience desire but suppress it because they believe it's inappropriate or impossible at their age, that suppression has costs. I also want to address the intersection of sexual health and cognitive health. There's emerging research suggesting that regular sexual activity may have neuroprotective effects, potentially reducing risk of cognitive decline. The mechanisms aren't fully understood, but likely involve increased blood flow, neurochemical changes, stress reduction, and the cognitive engagement required for arousal and pleasure. Your brain benefits from the complex processing involved in sexual response. Think about what happens during arousal. You're integrating sensory input, emotional states, memories, physical sensations, and motor coordination. You're in an altered state of consciousness, highly focused, yet also diffuse in awareness. This is demanding neural work that keeps multiple brain systems active and communicating. It's exercise for your brain, not just your body. So when you engage in self-pleasure, you're not just feeling good in the moment, you're investing in your neurological health, you're keeping neural pathways active. You're maintaining the brain's reward system. You're practicing presence and attention, which are protective against cognitive decline. These benefits accrue whether you achieve orgasm or not, though orgasm does seem to produce particularly robust neurochemical effects. Let me address something else. What if you've tried everything I've suggested and you still don't feel much, or orgasm seems impossible? First, Be honest about how long and consistently you've tried. A few half-hearted attempts won't reprogram decades of disconnection. But if you've genuinely given this focused effort over several months and you're concerned about your response, talk to your doctor about hormonal status, neurological function, medication effects, and vascular health. Postmenopausal women can sometimes benefit from local estrogen therapy, creams or tablets applied vaginally that restore tissue health without significant systemic absorption. This isn't appropriate for everyone, particularly those with certain cancer histories, but for many women, it dramatically improves sensation and comfort. There's also some evidence that testosterone therapy, carefully dosed, can improve libido and sexual response in postmenopausal women, though this is less commonly prescribed. Additionally, conditions like diabetes, multiple sclerosis, spinal injuries, or peripheral neuropathy can genuinely impair nerve function and reduce genital sensation. These require medical management of the underlying condition, though even with reduced sensation, pleasure is often still possible through different forms of stimulation or by focusing on psychological rather than purely physical arousal. The point is, don't suffer in silence. Don't assume this is just how it is now. Explore options. Advocate for yourself. If your doctor dismisses your concerns about sexual function because of your age, find a different doctor. You deserve medical care that treats your sexuality as an important component of health, not as an optional luxury. I want to share one more patient story before we move toward closing. Her name was Dorothy, and she was 79 when she came to see me, the oldest patient who's ever sought my help specifically for sexual concerns. She'd been in a nursing facility for 3 years following a stroke, which had caused some mobility issues but left her cognitively intact. She was embarrassed to ask, but she wanted to know if there was any way she could still experience pleasure. We talked about her specific limitations, weakness on her left side, some loss of fine motor control. We problem-solved together. I suggested adaptive devices, positions that didn't require her to use her weaker side, and most importantly, I validated that wanting pleasure at 79 was not only normal but healthy. I connected her with resources for accessible sexuality education designed for people with disabilities. 3 months later, she sent me a card. Just a simple thank you note, but inside she'd written, "I thought that part of my life was over. You helped me understand it was just waiting for me to reclaim it." She was 79. Let that sink in. If you're 60 or 65 or 70, you have decades potentially ahead of you. Decades during which you can experience pleasure, connection with your body, joy and sensation. Don't waste those decades believing the lie that you're too old. You're not too old for pleasure any more than you're too old for good food or beautiful music or laughter with friends. These things make life worth living at any age. As we move toward wrapping up, I want to give you something concrete to work with. A simple practice you can begin this week if you're ready. I call it the 5-minute body scan. Set a timer for 5 minutes. Lie down comfortably in a private space. Close your eyes. Starting with your feet and moving up through your body, bring your attention to each area for just a few seconds. Don't try to change anything. Don't judge. Just notice. What sensations are present? Temperature, tension, tingling, numbness, comfort, discomfort. When you reach your pelvis and genital area, give the same neutral attention. This isn't sexual touch yet, it's just awareness. Notice what's there without any agenda. Do this daily for a week. You're teaching your nervous system that it's safe to bring attention to these areas, that awareness doesn't have to lead anywhere, that you can be curious without pressure. The following week, if you're ready, add gentle touch to the body scan. Still not focused specifically on arousal, just caring touch. The kind of touch you might give to soothe a child or comfort a friend. Your body deserves that tenderness from you. Week 3, if it feels right, allow the touch to become more deliberately pleasurable. Use lubrication. Experiment with different pressures and rhythms. Remember, there's no goal here except to feel, no requirement to become aroused or reach orgasm. You're simply gathering information about what your body likes now, at this age, in this moment of your life. This gradual approach prevents overwhelm and reduces performance anxiety. You're building a relationship with your sexuality rather than trying to achieve a specific outcome. Some of you will progress through these steps quickly. Others will spend months on the first step, and that's fine. This isn't a race. I also want to leave you with a perspective shift that's helped many of my patients. Instead of thinking about sexuality as something you've lost and need to recover, think about it as something you're discovering for the first time, because in many ways, you are. The sexuality available to you now, with the wisdom, self-knowledge, freedom from reproductive concerns, and hard-won understanding of what matters, is genuinely different from what was available to you at 20 or 30 or 40. You're not trying to get back to who you were. You're becoming who you are now, and who you are now includes a body that still feels, a nervous system that still responds, a capacity for pleasure that didn't retire just because you did. This is your permission slip. I'm writing it in my official capacity as a physician who has spent 3 decades studying female health. You are allowed to want. You are allowed to touch yourself. You are allowed to explore, experiment, and experience pleasure. You are allowed to prioritize your sexual health as part of your overall health. You are allowed to invest time and energy in feeling good. You are allowed to use devices, lubricants, and techniques that make this easier. You are allowed to read or watch or imagine whatever facilitates your arousal. You don't need to justify this to anyone. You don't need to prove that you've earned it. You don't need to wait until you've lost weight or found a partner or feel differently about your body. You can start exactly as you are right now, in whatever condition your body is in, with whatever life circumstances you're navigating. The invitation here is to stop treating your sexuality as something that belongs to anyone else, a partner, a culture, a religion, a set of expectations. It belongs to you. It always has. Whether you've been connected to it or not, whether you've used it or not, whether you've enjoyed it or not, it's been yours all along. Now I'm inviting you to claim it consciously, deliberately, as an act of self-love and self-care. What would change in your life if you truly believed that your pleasure mattered? If you structured even small portions of your week around feeling good rather than just getting things done? If you approached your body with curiosity and kindness instead of criticism and disappointment? I've watched hundreds of women make this shift, and the transformation isn't just about sexuality. It ripples out into every area of life. They set better boundaries. They speak up more clearly. They pursue interests they'd abandoned. They dress in ways that please them rather than camouflaging their bodies. They laugh more freely. They take up more space without apologizing. Because once you reclaim ownership of your pleasure, once you stop outsourcing your sense of aliveness to external validation, you become genuinely sovereign, not in a grandiose way, but in a quiet, unshakable way. You know you can give yourself what you need. You know your worth isn't determined by desirability. You know your body is yours to inhabit and enjoy and care for on your terms. This is the work. Not just better orgasms, though those are nice, but the deeper work of coming home to yourself, of deciding that you matter enough to receive your own loving attention, of rejecting the cultural messaging that women over 60 should fade into the background and instead insisting on your right to remain vivid, vital, and fully alive. So here's your challenge for this week. Pick one small action that moves you towards sexual health and well-being. Maybe it's buying a good lubricant. Maybe it's setting aside 15 minutes of private time. Maybe it's doing that 5-minute body scan. Maybe it's simply touching your own skin with kindness and appreciation. Just one small action that says, I matter. My pleasure matters. My body deserves care. Then come back here and tell me about it. Subscribe to this channel so you don't miss future content about women's health, relationships, and the things nobody else wants to talk about honestly. Comment below with your commitment. You don't have to share details, just tell me you're going to try one thing this week. Right, I'm reclaiming what's mine. Let me know you heard this message and it resonated. And if you know another woman who needs to hear this, and I guarantee you do, share this video with her. Because we heal in community. Because your liberation makes space for hers. Because we owe it to each other to speak these truths out loud in a culture that would prefer we suffer silently. Your pleasure is not frivolous. Your sexuality is not optional. Your body is not done teaching you things about joy and sensation and being alive. Listen to what I'm telling you. You're not too old. You're not too damaged. You're not disqualified by your circumstances or your past or your appearance. You're a human being with nerve endings and neurochemistry and the same fundamental capacity for pleasure you've always had. Use it. Claim it. Celebrate it. Not because you have to, not because I told you to, but because you deserve to feel good in the body you have for all the days you have left. That's not indulgence. That's medicine. That's wisdom. That's living fully rather than merely existing. Thank you for staying with me through this conversation. Thank you for being brave enough to consider that maybe, just maybe, the best years of your sexual life could still be ahead of you. Thank you for being willing to challenge the stories you've been told about aging and desire and what's appropriate for women like us. I see you. I honor you, and I'm rooting for you to discover pleasure and vitality in whatever forms they take for you, at whatever age you are. Now go. Be kind to yourself, touch yourself with love, and remember, this is your one wild, precious life. Make it feel good.